Welcome. My name is Penelope Chatterton. Welcome to Awaken the Dream. My friends, I have a friend back with me today that I haven't seen in a while, and she looks better than ever, and I'm jealous. Her name is Dr. Kristine Suly. She is a medical cardiologist, and she works with healing and overcoming many, many difficulties that we all suffer from. And I don't even know where to begin with Kristine, but I always want to ask my guests, how did you ever get into this angle? This focus from being a medical doctor. Did you go to med school saying this is where I'm going to end up, or did you just go to med school to think in terms of the regular stuff?
Well, actually, I have had an interesting journey. I always was going to be a doctor from the time I was a little girl. And of course, this was when women didn't go into medicine. It was a male profession, and everybody said, girls can't become doctors. And except my mother said, yes, you can.
Yay,
and I just always kind of did what I said I was going to do. And so I went to college. I applied to medical school. I went to the Medical College of Pennsylvania down in Philadelphia. I got my MD degree in 1970. I did my internship, my residency, my cardiology fellowship, all at the Medical College of Pennsylvania. Very conventional.
Yeah, okay.
And I should mention, you know, conventional medicine doesn't teach you how to be holistic.
Amen.
Well, I mean, really doesn't. Our first 2 years of medical school, actually, we do learn how the human body works. We have anatomy, we have physiology, we have biochemistry. We learn, you know, how do cells work? What are all the little happenings that are going on inside the cell?
Who helps who?
And we passed the exam at the end of 2 years, and it's never mentioned again. Well, anatomy is.
Oh, okay.
But biochemistry, physiology, really never, ever emphasized again in our whole careers.
Interesting.
Third and fourth year of medical school, we learn what tests to order to come up with the diagnosis. And then once we have a diagnosis, what drugs and procedures to pick from. Now, that's the medicine you're familiar with.
You bet.
Well, and that's what I was trained in. I had no nutrition training, no wellness, no prevention, no health maintenance, no spirituality. There was no training like that in medical school, and there still isn't.
There still isn't.
There may be a bit now, but
yeah,
not much.
Yeah.
So I did my very conventional training. I did have all the conventional trappings. I became board certified in internal medicine. I became board certified in cardiology, and I actually practiced fairly conventional cardiology for about 10 years.
Really?
From the mid-70s to the mid-80s. And it occurred to me then, this doesn't make any sense. Here I was sending patients off for cardiac catheterization and very invasive, expensive procedures, and off for bypass surgery, and then maybe ultimately even angioplasty, where they go in with a balloon and open up a blood vessel. And they would come back into the office, and lo and behold, either the same vessel was closed back down or a different one. And I said, well, that was $10,000, $50,000, $100,000. Where did it get us?
Yeah.
And I said, you know, this vascular disease, cardiovascular disease, is a systemic disease.
What does that mean?
Your whole body.
Okay.
You got all these arteries all over your whole body.
Okay.
And it isn't just an artery in your heart that's narrowed. And at that point, I said, it doesn't make sense that this won't go away. But we were taught, once plaque, this narrowing in your artery was there, it was relentlessly progressive. It would never go away. And I said, it just doesn't make sense. It's kind of like, you know, laying down roads. You know, you lay them down, you can take them back up, even though the macadam is pretty hard.
Yeah.
And it seemed like if you put the plaque there, you ought to be able to get rid of it.
Sure.
Well, it was fortunate for me, because you may have heard of Pritikin.
Yes.
Pritikin.
Sure.
Well, Pritikin was not a physician. He was a businessman, and he had terrible coronary artery disease in his lifetime. He had multiple heart attacks. And his physician said, if you don't lead a sedentary life, you're going to die.
Sedentary.
Sedentary.
Ooh.
And he was not a person who took kindly to being told what to do. He was a businessman. And he said, no, that's not for me. He said, I am not going to do that. He said, I will change how I eat. I'll learn to eat healthfully. I'm going to exercise, and I will learn to relax, and this will go away. And they assured him it would not.
Oh, so he thought of the exercise.
Oh, he did. He thought of the whole idea of lifestyle medicine, which is eventually what I evolved into. But back then, nobody said, oh, sure, that'll work. But he did make the changes. And he specified that when he died, there was an autopsy to be done, and they were to look at his coronary arteries. And they did. And they were clean. Now, you would think medical science would say, isn't this good news? And you'd be wrong. They did not. They said, oh, it's just a fluke. That doesn't happen. And maybe it's an act of God. Maybe there was never plaque there to begin with.
He was lucky.
Yeah. And so that kind of passed. Nothing changed in the thinking until Dean Ornish. Now, you've probably heard of Dean Ornish.
I don't think I have.
Oh, my.
Dean?
What have you been reading?
Dean? D-E-A-N?
D-E-A-N. Dean Ornish was a physician who was actually the first one to show that Pritikin was right.
Ah, I did not know that.
Yes. He said lifestyle is what will turn things around. And he, back in the, well, probably the 80s pretty much, right around the same time that I was saying, this doesn't make any sense, he was saying, Pritikin is right and I'm going to prove it. And so his lifestyle heart trial, which is it's a controlled, randomized, very well performed and constructed study that is well respected. And he showed that if you change your lifestyle, indeed, plaque in your arteries goes away.
Wow.
And I always think that this picture right here, actually, if I can sort of point to you, why what he showed is so important. Now, this is, over here is health.
Okay.
And this is age.
Oh,
all right?
Okay. I'm in there somewhere.
So at birth, yes, we all are. At birth, you're 100% healthy. The black line here is the typical American lifeline. You start to decline in your 30s. You decline through your 40s and 50s. You're in poor health by 60. You have progressive disability and chronic disability, and you die in very poor health at 80. Now think about the people you know.
Yeah.
They're 80.
Yeah.
They're usually very poor health.
Yep. That's
Drugs
bad news.
Well, very bad. And drugs and procedures will not move you off this line. It'll drag out your end-of-life misery.
I see.
But it will not move you off this line.
Yeah.
If you want to move up to this ideal lifeline where you stay quite healthy till you're 70, you're going to have to die of something, so things have got to go. So they go. But even when you kick off in your 90s, you're still quite healthy.
Yeah.
The only thing that moves you up to that lifeline is lifestyle change.
Lifestyle change.
Yeah. If we make lifestyle changes, and this is why Dean Ornish's data was so valuable, that he showed that if you make the lifestyle changes, indeed, all chronic disease goes away.
Did somebody listen to this man?
Yes and no. Certainly, all the major organizations, the American Heart Association, the American Cancer Association, the American Diabetes Association, every organization has given lip service to lifestyle changes. Probably since the 80s, certainly since the 90s.
Yeah.
And so they always say first-line therapy should be therapeutic lifestyle changes.
Yeah.
And then, without a pause, they say, but since most people won't do that, we should use drugs and procedures.
Yeah.
And so we have a paradigm here, a Western paradigm, of using our technology, all our drugs and procedures, trying to manage chronic disease, which doesn't work. It just drags out.
Do you think that feels safe for people because that's all they know, and it's too much to ask of anyone to actually have to change? They always say human beings hate to change.
Well, but you know what? Education works.
Yeah.
And this is simple, I think. This has got such an easy solution and such an inexpensive solution. Suppose we educate people. Now think about, we've educated people about smoking. Have people stopped smoking? By and large, yes.
Yeah.
We educated people about seatbelts. Now when you and I were born, there were no seatbelts in cars.
That's true.
And when they came in, do you remember everybody think, I never put my seatbelt on? This big bravado. And now, do you pretty much ever see anybody who's
Yeah.
not strapped in? Do you ever see a child not strapped in?
Yeah. You almost feel uncomfortable without it on.
That's right.
Yeah.
And so education works. And in fact, I do a 12-week workshop that's called First Line Therapy, and it's therapeutic lifestyle changes with the idea of training people how to eat healthfully, exercise regularly, learn to relax, develop good social and emotional support so that they can achieve ideal body weight.
So you do the
and good
whole
health.
picture.
The whole thing.
I love that.
It's a 12-week program. We meet for about an hour and a half every week. I actually measure, using bioimpedance, I measure how much fat they have and how much muscle they have.
Ooh.
And I do it 3 times throughout the course so that, because I'm going to be cutting their calories,
Yeah.
and they have to eat every 3 hours.
Oh.
So they're never hungry.
Oh.
And when you're never hungry, they always think they know better than I do. That if they don't feel hungry, they'll just skip that meal
Yeah.
or that snack,
Oh.
and they'll lose weight faster.
Yeah.
And I say, no, you'll throw
It's a
yourself
terrible,
into starvation
terrible setup.
mode.
Yep.
And so I measure fat and muscle at the beginning, then at 5 weeks. And those who thought they could skip meals, they look and they go, oh, no, I've lost muscle.
Ah. You know, deprivation brings out the worst in all of us. It's like, what? And
Well-
then you have a tantrum and overdo it.
Well, that's it. And we truly have an obesity problem in this
Yes.
country. We are the fattest country in the world. Now, it's interesting. Japan is the thinnest. Japan and the U.S. have the most technology in the world. Japan has slightly more than we do in terms of drugs and procedures and technology.
Yeah.
But they don't use their technology for all management of all disease, acute and chronic. They pretty much use it for the acute care.
Really?
Mack truck runs over you, you're
Okay.
bleeding to death, your bone's sticking out through your skin.
Got it.
Somebody's got to press on the artery.
They will jump.
sew it back up, put the bone straight, put it in a cast, you know.
Yeah.
But the idea of using drugs and procedures for chronic disease just doesn't work.
Yeah.
And we're a perfect
And they know
example of
this. They know this.
And so in an Eastern paradigm, like the Asian cultures, we have an Eastern paradigm which is more energy related. They do acupuncture, they do
Yeah.
energy kinds
Yeah.
of things. They treat acute disease with all their technology, but the rest they do not.
They're veggie people.
Well, their diet is actually not as healthy as you'd like to think.
Really?
Too much soy sauce,
Oh.
too much sake,
Too much sake. Darn.
and they smoke. Smoking
do.
is rampant in Japan.
Okay.
And their work and educational stress is the highest in the world. Tremendous stress.
How bizarre.
But even though our lifestyle is not healthy, theirs is not healthy, we both have comparable amounts of technology. We spend a fortune on medical care, and I use the word care very loosely
Yes.
there.
Yes.
And they spend very little on medical care.
Yeah.
Yet the World Health Organization evaluates every single country every year.
Yeah.
Japan is always the healthiest and the longest lived.
How interesting. It's a
We-
smoggy city, though. Isn't Japan smoggy?
I don't know, never having been there.
Yeah.
I mean, certainly their lifestyle is not the healthiest in the world.
Yeah.
Nevertheless, they are the healthiest people in the world, and we are not.
Do they work out? Do they walk everywhere?
Well, they do, and they bike. They're certainly physically much more active than we
Yeah.
are. But they also don't use drugs and procedures for everything.
I like that. That sort of tells us a lot.
Well, you know, the AMA was very forthcoming in saying that physicians are the third leading cause of death in this country
Ooh.
because they prescribe drugs and do procedures.
So that's why I turn them down.
Good girl.
Yeah.
So
Yeah.
in Japan, they don't use drugs and procedures for everything.
Okay.
And when we look at how our health is, except for acute care, we don't rank number 1. We don't rank number 2. We are at the bottom of industrialized
Yeah.
countries.
You're a wonderful teacher. I've heard you speak before at some of your little seminars, and you love what you do.
I do love it.
You love it, and it's
Yeah.
and I'm glad to hear you came as a product of Western medicine, and then realized that a lot of the procedures weren't getting us anywhere and spending a fortune. And do you think we're getting anywhere, Kristine? Or
Yes,
are
we actually are. It's slow, and in many ways, the old guards have to die off.
Oh,
It's sad in medicine because we are told when we're in training, and yet we don't really want to have to think. 75% of the facts in medicine subsequently change, or are outright wrong. Now, think about it. You go to see the doctor, and he gives you advice. There's a 75% chance that it's wrong. Now, that's scary. It wouldn't be so scary if the advice he was giving you was something innocuous, like, let's have you eat more fruit and vegetables.
Yeah. Yeah.
But it is scary when he says, take this drug.
Yeah, or let's up this.
Get this procedure.
Yeah, if that's not working, then let's make the dose bigger.
Yeah. And so we are told. And the other thing that always amazes me, I guess everybody now is very frustrated with medical care because they don't feel the visit is long enough for them to be heard, to be understood, to ask questions, to be educated, to get answers, to be reassured.
Yeah.
And it's true, the average physician visit is now 6 minutes.
That's why I love my vet.
Now there's a perfect example. Insurance has done us in.
Yeah.
That physicians, you and I are old enough to remember when we used to go to the doctors. We went to the doctor's office without an appointment. No receptionist there would be arrogant enough to tell you how many minutes you were entitled to. And so you went to the waiting room where you were going to wait. Whoever was there ahead of you, they got seen first.
Yeah.
However much time they needed, that's how much time they got.
Yeah.
They paid a fair fee for a fair service. They were happy, doctors were happy. You didn't resent waiting in the waiting room because you knew when you got in, you would get however much time you needed and you would pay a fair fee for a fair service. If you fell on hard times, I come from a very poor family. There were 6 children. My father was a machinist. Wow. If he earned $80 a week, that was a lot of money. We were poor.
Yeah.
And my mother and father could never have afforded to pay for all 6 of us to have anything. You know, medical care, new clothes, whatever. And the doctor would cut us a break. Or my mother would barter with him. My father was working. My mother took us to the doctors.
Yeah.
My mother would barter with him. We lived on a farm. Or, he wouldn't charge us. Or we'd pay overtime.
Yeah.
And you remember doing that?
Yes.
Well, and if you were too sick to wait in the waiting room, he made a house call. Now, think about it. Now you go see the doctor. You have an appointment. You show up at the waiting room, and what do?
Fill out forms.
And wait.
And wait.
And wait. And wait. Because when physicians schedule such a short amount of time per patient, heaven help you if somebody has a real problem. You're not going to get it done in 6 minutes.
Yeah.
And so, by and large, we now have appointments, and we go and we wait in the waiting room.
Yeah.
And then when we do finally get in, the physician is in a hurry or is usually behind.
Yeah.
And so he has one hand on the doorknob, and I know patients have come in and said they've gone with, several problems. And you need to hear all of somebody's problems because they may tie together.
Sure.
And yet the physician will say, wait, we can deal with one thing. If we're going to deal with other things, well, you'll have to make another appointment. He can't do it in 6 minutes. And so we now have evolved, mainly because the insurance company wanted to reimburse physicians for the office visit. Because insurance in the past did not cover the office visit. It covered hospitalization.
Yeah, that's true.
And now everything's covered. So we technically don't have health insurance, if you think about it.
Yeah, yeah.
Car insurance we do have. Your car insurance protects you if you have an accident, you run over somebody's kid, something like that. Catastrophe. It doesn't pay for you to get back gas in your car. It doesn't pay for you to get car inspection each year.
No.
It doesn't pay for you to put new tires on your car, to get a tune-up.
True.
Okay?
Yep.
It protects you from a catastrophe.
Yeah.
What we have now is prepaid medical care.
Yeah.
And unfortunately, the insurance companies reimburse physicians so poorly. I mean, I used to participate with insurance. I don't anymore. I don't.
Good for you.
No. I have always practiced medicine the same way. I spend 2 hours with the initial visit. I spend an hour with every follow-up.
Nice.
Because that's what they teach us to do in medical school.
Yeah.
And I thought if they teach you how to do a good history and physical, you probably should do it.
Yeah.
And it takes 2 hours to really get to know a person.
Yeah.
Holistic is a matter of seeing the whole person.
That is true.
Not just the heart disease, not
Yeah.
just the high blood pressure, not just the high
Do you do
cholesterol.
blood tests and
I do.
I do the normal battery of
I
let's
do.
take a look and see what things.
Well, I do a lot of lifestyle medicine, so I am always doing blood work because people need to see. They need motivation.
Yeah.
It's not easy to turn your lifestyle around.
Yeah.
I mean, people have been eating, exercising, not exercising, relaxing, not relaxing,
Yeah.
20, 30, 40, 50, 60 years.
Yeah. It's to an
I'm not going to turn it around overnight.
Yeah, it's to an advantage. In our day, we did have gym. You know, we had
Yes,
something going on.
that's right.
And I think that's sort of cut down. And
It is interesting to see what schools cut
because we were
back
very
on.
active as kids, and we ran around at night, and it seemed like everyone's running around with a computer. And
Well, everybody's doing this.
yeah.
Yeah. Their thumbs are getting good
The
exercise.
thumbs are getting good exercise.
We are a very sedentary society. And I always emphasize this, whether it's in the workshop or whether it's with a private patient. Exercise, I mean, eating healthfully is very important.
Yeah.
Learning to relax, very important, because we are very stressed.
Yeah.
Having good social and emotional support, people who care about you, people who are there for you, very important.
Yes,
But the bottom line is exercise is absolutely critical.
I think so.
If you don't exercise, it's not going to work.
Yeah.
And you can't ever stay healthy if you don't exercise.
You kind of use it.
Exercise is not just a matter of, oh, let's go for a little walk.
Yeah.
It's an hour a day of brisk exercise.
I hope our friends are hearing this.
Brisk.
Brisk.
Now, brisk means, and people, you see people, they're running along, they're checking their pulse, they're looking like this, and I'm thinking, are we having fun yet? But
Oh, dear.
the way to know if it's brisk, we don't have to be monitoring ourselves all the time, because we're supposed to be enjoying our exercise. Remember when we were kids, what did we look forward to? Recess.
Recess.
We wanted to get out there and
Getting
run around
home and
play.
playing. Yep.
Right.
With our buddies.
So we should enjoy playing, getting out, running around.
Yep.
We
Yep.
don't need to be doing this.
Of course, I did that as a marathoner.
Well, now,
But
the bottom line is, brisk means you can just barely carry on a conversation. If you can't carry on a conversation, it's too much exertion.
Exactly.
If you can carry on a conversation easily, it's not enough.
I hear you.
So it's a good judge. You can
Yeah.
carry on a conversation while you're walking, or
Yeah. And
whatever.
some kids have a predisposition of just loving to move. Their genes just
Well,
scream to go.
We do as children.
Yeah.
And the question I always say, when did we stop wanting to play?
Yeah. Well.
When did we?
Yeah.
Try to think.
Well, I
In
keep thinking, as a
college, we
vain
like
woman,
to.
we all want to look right. We want to have, our
Yeah.
tummies are tight. We want to look good, and I think we know, exercise certainly helps put a little rose in our cheeks and
Everything.
everything. Sweating is good for the skin.
Yeah. If you look at the benefits of exercise, it's about 4 pages long.
Really?
Yes. I have an article that I did on exercise, and it goes on and
I'm
on
walking
and
home
on
after
and
this
on.
program.
Good girl.
The car.
But exercise is critically important.
Yeah.
And we are terribly sedentary. And it's interesting, we didn't get sedentary overnight. It is true, at some point we stopped wanting to play and run around.
Yeah.
But worse than that, think of all our energy saving steps. Remember we used to type, dum bum 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 bring, bum 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 bring. And now how do we type?
That's
Or
very colorful.
We used to, we learned on a stick shift. Did you learn on a stick shift?
Yes,
So
I did.
And so you got to work the clutch.
Yep.
And shift. Now we don't.
Yep.
Just put it in gear, press the accelerator.
Yeah.
We used to have to get up and adjust the rabbit ears on the TV.
Yeah, or hang
change the
the
channel.
laundry out.
Now we don't.
Yeah.
Not any one of those is so critically important, but altogether they're very important. We are very, very sedentary.
Yeah.
And it shows. We are a terribly obese population. 80% of our population is overweight or obese.
That many.
More people are obese than just overweight. I mean, look around.
Yeah.
We are so accustomed to looking at fat people that we don't recognize normal weight.
that's
It's really funny when I tell people how much they should weigh.
Yeah.
I always make sure they're sitting down. And if
dear.
I tell men how much they should weigh, they always say, oh, I could never lose that much weight. My friends would all think I have cancer.
Oh dear.
Because they think they'd look emaciated.
Oh dear.
If I tell women how much they should weigh, they say, I could never lose that much weight. My wrinkles would show.
I've heard that one.
I know you have. Because you know, when you're fat, it fills out.
Yeah.
And your wrinkles don't show.
Oh dear.
I know. But the bottom line is we are tremendously obese.
So we eat well, we exercise, we meditate,
Learn to relax.
and we're trying to find this balance.
And good social and emotional support. Did you ever notice how...
We have 2 minutes. I've
Oh.
had to just, because we're going to have another show.
Okay.
But I want to see if we can sort of pull this together for our friends.
Well, did you ever notice how unintimate we are? Think about neighbors. The things
Oh.
we know about our neighbors are things we don't like. The dogs bark, the kids are too loud, I don't like their parties, their music's awful.
Oh, yeah.
Intimacy.
Yeah.
True intimacy.
Interesting. So
Very
you think we're
important.
backing away from that?
We got to move forward to it.
Well, we do. But
Yeah.
why do you think we do this? Why are we antisocial? Or are we?
We are. We
Yeah.
are. We're too busy.
Okay.
We're way too busy.
Way too busy.
Yeah. We have, I mean, remember before, although they were well-defined roles and maybe not nice, women stayed home, you know,
Got that.
men went to work. Now everybody goes to work. So how do you manage? I mean, I grew up female, going to medical school, going to work, having a child. Now, when I had my child, I only worked 4 hours a day
Well,
because it was important to raise my child.
yes, it was.
And
it was.
but most people don't have the luxury.
Yeah.
I was in practice. I could change my hours the way I wanted to. But most people go to work 8-10 hours a day.
This has been the most wonderful introduction to who you are, and I'm going to say farewell to my friends because we have another show to do.
Yes.
Thank you, my friends, for joining us on Awaken the Dream. We will talk to the doctor again soon.